Thanks everyone for being here. Okay, got it. Thanks everyone for being here. Again, as Dr. Ponero was saying, this is the master's thesis project of Philip Nguyen-Powanda, and Prachi and I joined the team to help with this particular article, this particular project, and it's with the lab of Dr. Julio Fiore. So as we continue, it's just I got involved shortly after the Journey of Surgery app was released. So this is just part of the process of making sure that the implementation of apps in medical care is evidence-based. So this is the use of mobile health applications to support perioperative care and surgical recovery. So why is this pertinent to us right now? Let me make sure, here we go. It's because as access to mobile phones increases, their implementation as a tool in healthcare is also becoming more practical and more feasible. And since apps have been starting to grow since about the turn of the 21st century, so now there are actually thousands of medical apps on the market. And why are we trying to implement them in medicine? Because they're sophisticated tools that just about everyone has access to. So it's already a tool that your patient is used to using and is already in their hand. So why not optimize on that? Things that make them relevant is that there's increasing access to mobile phones despite socioeconomic status. And of course, this isn't across the board. There are still disparities, but they're definitely becoming more prevalent in society. So a lot of people have them. They can improve the strain on the healthcare system. So as we've been actually witnessing in largely in the past 20 months, is that sometimes we can provide high quality care from a distance, and this can save a lot of time and a lot of resources. But we have to make sure that that distance care is good quality. And that's another thing we want to ensure with this research. And some could argue that the quality provided by mobile apps could even be superior because it provides a sense of ownership and mastery for the patient over their healthcare journey, because they have the tool in their hand and they're able to work with it and navigate it, and it gives them extra motivation. Also, I find that a lot of the time when you have a medical procedure done, there's a great deal of information you need to research yourself, and it can be intimidating and a little bit complicated. So it's good if you have it in a healthcare app and it can summarize it and keep it navigable and storable, so you can always use it at a convenient time. So that's, yeah, easily navigable information. Apps have been used for wound monitoring, so you can like take photos, or they have been connected to wearable monitors, so we're able to catch like if a patient is declining after a procedure quickly, we're able to monitor in real time, which is a useful implementation. And in underserved regions, they could increase access to care. Now, these are the promising aspects of mobile apps. These aren't necessarily evidence-based yet. They're not all proven, but this is just what makes them a good candidate for study. I just thought I'd throw in a little nuance here. There are two things we could discuss. We could discuss telemedicine, and we could discuss mHealth or mobile health. And in this case, we're going to be discussing mHealth. And the difference is telemedicine or telehealth is the provision of medical care remotely by means of telecommunication. So basically an appointment online using like call or direct messaging or video call services, whereas mobile apps can provide a wider range of services. So it could be alarms reminding you to take your medication, or wound monitoring, or information just for you to understand your condition or your procedure, or to increase your adherence. So it's a wide range of things that can be provided, and it's done through a mobile app. So that's what we're focusing on today. And to further define what we're focusing on, the leaders of this project realized that apps that were used by healthcare professionals were already better studied. So this particular study is going to be focusing on patient-centered apps, the apps that the patient gets to use as well in their healthcare journey. And as you may have noticed, we're presenting to the research group of pediatric surgery. So it will be surrounding perioperative care. So it's the implementation of these apps in perioperative care, but we're not limiting it to the pediatric population. It's going to be the whole surgical population. So things that have been implemented, examples of how they've been used in the past. They've been used for patient and family education. So just so that you're up to date on what to expect and what's happening in your procedure, your surgery. They've been used to monitor adherence to treatment. They've been used to assess wound healing and with photos, which is a pretty cool application. They've been used to track self-reported recovery, and they've even been used as distraction during anesthesia or if the surgery is done on an awake patient, they've been used for distraction. So this isn't an exhaustive list, but these are the concepts that stood out to me while we were doing the screening of many surgically related apps. And finally, what is the purpose of this particular study? There have been, like, as mobile apps are increasing in prevalence, there have been lots of research done on them, but as it stands, it's rather heterogeneous and the surgical specialty remains understudied. So what we're trying to do is assess the availability of this type of research and to be able to make it more concise and draw robust conclusions that could be used in medical guidelines. So for instance, studies have shown that they could improve adherence to care and reduce risk of readmission after surgery and increase patient satisfaction, but it's hard to be conclusive about these because the studies are so heterogeneous. So that's going to be one of our goals, and I believe the objectives is next. Perfect timing. So in doing this, in our scoping review, we're going to be assessing the research surrounding patient-centered mobile health applications supporting perioperative care and surgical recovery. We could break that down into three things. We'd like to characterize the types of studies, the types of apps used and characterize the way that they're being used. We want to compile and summarize and assess the quality of the evidence regarding their usability, their feasibility, their acceptability, and especially their impact on surgical outcomes, so hard outcomes, to make sure they're evidence-based. And finally, we'd like to identify areas where further research is required, where the research that we have isn't sufficient to inform clinical guidelines. And hopefully, in doing so, we can lead to further research projects and maybe subsections where we could make meta-analyses and draw really informed conclusions about their implementation. So to talk to you about the work that we did on our project and the methods, my colleague Prachi is going to be assisting us.
So in terms of the methodology, as Chris mentioned, we did the scoping review. We conducted it following the CIHR knowledge synthesis guide and also methodology proposed by the Aksi and O'Malley. For the literature search, Elena and other medical librarians helped us with the search strategy, and it was also peer reviewed as well. They conducted literature search using comprehensive search using major online databases. We also included trial registry, conference proceedings identified via Scopus, Embase, and references and citations of the included articles to broaden our search as well. In terms of the time period, we restricted our search between 2007 and 2021. The reason being the 2007 was the year when the smartphone app platforms such as iOS and Android become widely available to the users, and we wanted to capture that in our study as well. There was no language restriction in our search strategy. Next slide, please, Chris. So in terms of the eligibility criteria, we defined mHealth as a program or software which was accessed by a mobile device and designed to support healthcare and to communicate medical information as well. We included apps that was designed for the adult and pediatric patients undergoing major surgeries. The major surgeries we defined as WHO, which is any interventions occurring in hospital OR involving incision, excision, manipulation that requires regional or general anesthesia. We also included apps that were targeting informal caregivers, especially parents and guardians of pediatric patients. We included studies that were talking about video conferencing, text messaging, and social media if it was used in conjunction with the mHealth application. We also included studies that were discussing the design and the development process of the mHealth, which was targeting specifically to the healthcare and the patients. Given the exploratory nature of our review, we included studies with the broad range of methodologies, including case reports, cross-sectional systemic review, meta-analysis. We excluded those studies who didn't specifically evaluate the usability, feasibility, or effectiveness of the mHealth apps, or didn't talk about the development process of the mHealth. We also excluded apps that were exclusively designed or used by the healthcare providers or the healthcare trainees. We also excluded studies that involved minor surgery that were basically conducted in the primary or secondary care settings, And we also excluded studies discussing percutaneous procedures. The apps that were only available on desktop PCs or laptops and doesn't include mobile application, we also excluded those. And the editorial opinion papers and conference proceedings that were not aligned with our study objectives, we excluded those. Next slide, please. So the retrieve articles from the search strategy were collected in a combined library. It was created using the Covidence systemic review software. We also used Covidence for our screening as well. Our study protocol was pre-registered with the Open Science Framework, and we reported according to the preferred reporting items for systematic review, meta-analysis extension for scoping review statement. Initially, two lead reviewers, Dr. Fiore and Philip, did the pilot testing on the eligibility criteria on a random sample of 100 abstracts. Followed by that, the 6 independent reviewers, including me and Christopher, we did the title and abstract screening. Each reviewer screened around 4,000 to 4,500 abstracts. Next slide, please. And this is our Prisma flow diagram. It is partially filled currently because we are still in the initial phase of our study. Initially, we identified 23,787 studies from the databases and the gray literature. After the duplications removed, we included 22,535 studies, which we did initial screening for. After excluding articles, currently we have 1,651 full text studies. And currently 2 reviewers are doing full text review as of now. Next slide, please. So this is our estimated timeline. Currently, we completed the initial abstract screening. 2 reviewers are doing the full text screening. And the next steps will be, we will focus on the extraction protocol and working on the full text extraction. And hopefully we'll be able to complete our study by the March next year, hopefully. So we are hoping that after this study, it will provide us clear idea about the current state and the knowledge gaps in terms of the mobile health application, specifically during the perioperative care and recovery after the surgery as well. And we are hoping that it would provide us significant results that we could use in the future directions for our research as well. And yeah, we are looking forward to showcase our end results with you in the future. Thank you.
Thank you, Dr. Dan, for the introduction. And yeah, hi guys, my name is Ahmed. Thanks everyone for joining. And I'm going to be presenting our project. So just a disclaimer, we just started this project. So I think we agreed that we're kind of just going to take it lightly and we're just going to explain the background and the clinical implication of the project. And it'll be a good introduction for the patient partners as well. So I'm going to go as slow as I can with all the terminology. And if you have any questions, just maybe you can type it in the chat or you can ask me at the end of the presentation. I'm very open to that. So yeah, our project is the use of natural language processing on pediatric diagnostic radiology reports to identify and grade perforated appendicitis in children. So let's just start by discussing a little bit of the clinical background. So acute appendicitis is the most common surgical emergency in children. And as the name implies, it develops very fast, usually in the span of several days or hours. And luckily, roughly 2/3 of the children that present with acute appendicitis, they present with a simple one. And unfortunately, the other third, they progress to perforation. So because of the sort of the quick timeline of appendicitis, you don't want to really, it's like a ticking time bomb. So the patient comes very ill and you don't, like a simple appendicitis can very easily become perforated. So this usually requires a very prompt medical treatment and it's usually a surgical treatment. So to diagnose appendicitis, I mean, clinicians usually rely on the clinical presentation, selected laboratory results and imaging data. For the imaging data, we usually use ultrasound because it's the most efficient, it's fast, it's readily available, and it can give us a good idea of what's going on, especially if there's inflammation in the appendix. There's also several scoring systems that have been developed for identifying acute appendicitis, such as the Alvarado score. And these are usually used if we're not sure if this is appendicitis or not. So this diagnostic criteria, it's quite robust and it works. But the problem is that we have a difficulty to determine the perforated appendicitis from the simple or just the inflamed appendicitis. And that creates a big issue. So all of the, if I can just go back, so all of these diagnostic sort of scores and systems, they're able to say this patient has appendicitis or he doesn't have appendicitis essentially, but it's not able to specify what kind of appendicitis this patient might have. So the only way we can find out is the presence or the extent of the perforation is actually during the surgical intervention. We go in and you'd actually be able to see how severe the perforation is. Because of that, our current treatment protocols cannot be customized by the severity of appendicitis. And that's important because we actually don't know, before going in, we don't know how bad the appendicitis could be. So it would be very helpful to identify high-risk children for perforated appendicitis to prevent complications and longer hospitalization by bringing these children to theater earlier. And it can also allow the hospital to allocate more resources for such patients. So our potential solution, or this is sort of what Dr. Punero was led to, is that predicting perforation and the grade of the perforation preoperatively is very helpful, or it's very high yield. So our objective was to develop and validate a tool for predicting a perforated appendicitis and its grade preoperatively using natural language processing on radiology reports. So this is the last time I'll say natural language processing without explaining it. So I'll actually just use the shorter term. So we use NLP for it, and it'll just be a lot easier to explain it. So NLP is part of a system. They're all, I guess, like really buzzwords now in the tech world, like artificial intelligence, machine learning, deep learning, all of these things. And NLP is part of that. So it's a subdomain of linguistics, computer science, and artificial intelligence that deal with training machines to comprehend human language. So the natural part of it refers to a form of speech or text that follows human communication norms. So the idea is with NLP, we can correctly extract information and meanings from human unstructured text to communicate information. So if you've ever used, I guess, if you ever used Google Translate to look up, like a difference from French to English or vice versa or another language, sometimes that really fails or it doesn't translate well. That's because a translator like Google Translator doesn't really work on machine learning, and that's why these things need to be a little bit better because context is very important when it comes to NLP. So to map the complexity of words and meanings in sentences, it's essential to capture the context. NLP helps model these complexities into mathematical form for it to be machine readable. So by machine, it means computer. So we really want to convert sort of like common speech, common context, and we kind of put it in a format that the computer will understand. And it's important, I think context is very important because that's the thing that needs the most attention, and that's the thing that needs the most training for. So for example, here I have a specific line. It could be from like a radiology report, and let's go over it, and maybe I'll use it as an example. Maybe that will be a little bit easier to understand. So this sentence says, no evidence of bowel obstruction or mass identified within the abdomen or pelvis. So we can easily pick up that the no is actually for the bowel obstruction and the mass within the abdomen or pelvis, right? But if you put this into a simple sort of algorithm, it will think that there's no bowel obstruction and there's a mass identified within the abdomen. it's very important for the NLP to understand the context of the use of, for example, the word no, that it's both on both sort of variables, will be on the bowel obstructions and the mass as well. And that's why it's very important to have context in the system. And I guess that's like usually what takes the most time, is to give it the context it needs to be actually able to understand. So the radiology report. So the radiology reports usually like accounts for almost a big majority of the unstructured format or the free text in any like hospital health system. And unfortunately, it's not very usable because it takes a lot of effort to interpret these reports. So they usually contain rich contents about the stage of the disease, dimensions, features of surrounding structures. But because of the format it's presented with, which is free text, which is like sort of English language, it's hard to actually interpret without having an expert that reads the text and infer the report. So this is where NLP can come in place, because it can help reduce significant time and efforts in extracting such information. And when we do extract this information, we can start to actually see some correlation between what was being written and some of the results that we can see. So I think I have here an example again, just on the right side. And again, it's a simple example. And there's a difference between the sort of the annotated radiology report that you would see. And then with the help of NLP, you can classify in different things in different regions. And by having that, it's very easily to link different information together in a good summarization format. So for our study design, I just put this sort of slide for just, I guess, just to show how the NLP system works. I don't think I'm going to go through each individual point, because that would be very sort of techie, I guess. But yeah, so essentially we have the radiology report. It goes through a specific system of cleaning up the data and actually being able to base a context around this data. And then after that, we have the sort of final or the evaluation format. This format is the one that's going to be useful whether we want to actually see if there's any correlation, whether we want to speed up the process or just straight up interpret the data. This is sort of the design. And of course, we use like a programming language here. For this one, we usually use a programming language called Python. It's a very popular one, usually used for like data science and these sort of projects. So this is a slide for our current development. So we are in stage 1 or phase 1. So this is going to be a retrospective study. So we're looking at children between the age of 1 and 18 with the final diagnosis of acute appendicitis. And we're looking for somewhere between January of 2015 to end of 2021, which I think, if I remember correctly, was around 2,000 patients. And luckily, we also have the final perforation grade because this is a retrospective study. We're actually able to see what was the result from all of these cases. So what we'll try to do is we'll try to find a correlation between the reports and the final results. So the result would be sort of our a way to see if there's a correlation. For example, if the size of the appendix is a specific size, that can kind of relate to a specific grade or a specific result at the end. So currently we have a sample of reports, and we are currently building the NLP classifier based on it. And yeah, so I try to end the presentation with just some analogies of everything else was not very clear. Just I found this pretty funny. It's just we're essentially trying to teach a dog what to understand. That's what it is. Dog is the computer. We're trying to make it to explain, and we don't need to give it the context, as in we don't have to really teach the dog about climate change. You know, we need a very specific set of things that we need to teach them, and that's what we do with NLP. So thank you so much, and if you have any questions, please let me know.